Welcome back to the American Diabetes Association's 82nd Scientific Sessions in the one and only New Orleans. ADA TV is here again to bring you the highlights of this year's meeting. Today, we'll talk to Outstanding Scientific Award winner Anna Gloin and checking out what's happening at the exhibit hall's ADA booth. Plus, we'll hear from you, the Scientific Sessions attendees, to find out what you're most excited for at this year's meeting. ADA TV starts right now. I'm Nikandra Norwood, host of ADA TV. We've got a great show ahead for us, but first, let's hear about some of the sessions happening today that you won't want to miss.
Welcome back to the ADA's 82nd Scientific Sessions. I hope everyone's had a chance to check out some of the amazing sessions and discussions so far. I also want to remind you about the on-demand access for anyone who missed anything from Friday or Saturday. Today is Sunday, a truly packed day. So here are my highlights. The centerpiece for Sunday is the ADA President Medicine and Science address delivered by Dr. Guillermo Ampierrez at 10:15, who will discuss metabolic regulation of insulin secretion in health and disease. His address is immediately followed by the ADA's Banting Medal for Scientific Achievement lecture by Dr. Francis Ashcroft from the University of Oxford. Professor Ashcroft helped define the field of channelopathies, establishing the role of K-ATP channel in insulin secretion, the mechanism of action of sulfonylurea medications, and the etiology of specific forms of neonatal diabetes. Professor Ashcroft's work has substantially impacted the treatment of neonatal diabetes, allowing transition off insulin injection therapy for affected individuals. So don't miss this highlight of our conference. At 2:15, you're in for another treat. The Kelly West Award for Outstanding Achievement in Epidemiology lecture, delivered this year by my colleague and friend, Dr. Jill Norris, from the University of Colorado Anschutz Medical Campus. Dr. Norris will talk about type 1 diabetes and diet and how her work is moving the field from epidemiology to precision prevention. We end the day with a symposium at 4:30 p.m. on expanding the type 2 diabetes care focus to weight management and control, titled New Weight Management Strategies for Obesity in Type 2 Diabetes Care, focusing both on medical management and on surgery, a session also live streamed. I hope that you will find these and the many more planned sessions informative, relevant to your practice or research, and enjoyable. See you all tomorrow.
The most important thing to me, I can see how the people working in the world, because in Pakistan there's a different way of working. Here we can see how the people they are working, treating their patients, what the technology which is being developed.
It gives us the chance to really firsthand hear how we can, as a brand, as One Touch, help both consumers and patients and healthcare professionals bridge that gap and get to better outcomes for the really difficult journey that many of our type 2 diabetes patients have. So really excited to hear more, to participate in conversations and be on panels, and see what we can do to together make their lives easier.
Welcome to the 82nd Scientific Sessions. We are so excited to exhibit here in person this year. We have a lot in store for you in our ADA booth. Come visit us, learn a lot about our nutrition programs. We have a lot of new features and functionality on our Diabetes Food Hub website. We have a lot of information on programs and resources for your patients, as well as our research booth, learn about all of the things that we've got going on in research. And then don't forget our National Initiative session, where you can learn a lot about our Know Diabetes by Heart, Focus on Diabetes, and our camp programs, and so much more.
So our final station is the Education and Prevention Station. So there you can learn all about our education recognition program and how to help your diabetes self-management education program. In addition, you can learn about the diabetes prevention program and how DPP Express can help your organization manage your data. Finally, we have our small theater where you will see different presentations throughout the weekend. We'll have presentations on Saturday, Sunday, and Monday. Come check out the booth for a schedule of those presentations. And then we also want to make sure that you stop by our KDBH booth as well as our advocacy booth and learn about all the opportunities they have to offer.
If tchotchkes and espresso are your thing, we have all of that in our booth. Come visit us. We're excited to meet you and excited to reconnect in person. Join us at the American Diabetes Association booth this year.
The Immunobiology Laboratory at the Massachusetts General Hospital has advanced understanding of the role the human immune system plays in autoimmune diseases, cancer, and transplantation. From basic research to tuning the immune system in to fight cancer to a phase 2 clinical trial to reverse type 1 diabetes. The lab conducts and then translates basic research in applications that help patients.
The BCG vaccine is over a 120-year-old vaccine that was developed in Paris, France, originally for tuberculosis prevention. But gradually, over the last 15 years, global clinical trials have started to show, even in phase 2 and phase 3 trials, its effect in autoimmune multiple sclerosis and autoimmune type 1 diabetes.
It's very emotional for us to, see him live his life like this. Some days are good and some days are not so good. 5 years ago, when we found out he had type 1 diabetes, we knew it was a chronic medical condition and that it's been around for so long and there's no cure or there's nothing that's in the horizon that might help. And now there is something, and it's very exciting that it could possibly change his life.
Now, Liebenberg Lab is a core unit of the Rena and Avner Schneur Diabetes Research Center, focusing on stem cell-based tissue engineering for various disease modeling and treatment. Find out how their implantable muscle construct is offering a new kind of treatment for folks with type 2 diabetes.
Our lab at the Technion Faculty of Biomedical Engineering is focused on stem cells and tissue engineering for regenerative medicine. We engineer tissue constructs like bone, skeletal muscle, cardiac muscle, spinal cord, and the idea is to engineer tissue that can really fully integrate after implantation.
The solution that we came up with is the engineered skeletal muscle enriched in GLUT4. This construct can be used as an actual treatment in diabetic patients.
We implanted the engineered construct into the abdominal muscle of diabetic mice, and we followed the fasting basal glucose levels throughout the 4 months. We had a normalization in the glucose levels and a reduction of 26%.
We are developing constructs that can be injected straight into the muscle, thus avoiding the pain, the risks, and the discomfort associated with an open surgery.
This engineered muscle tissue construct has a potential not only in diabetic patients, but also for other muscle diseases and pathologies.
Make sure to check in for more exciting content on TV screens around the convention center, in select hotels, on hotel shuttle buses, on the Scientific Sessions website, and on YouTube and Twitter. Be sure to check out the ADA TV newsletter by scanning the code on your screen. We're here with the ADA Outstanding Scientific Achievement Award winner, Anna Gloin, a professor at Stanford. Thank you so much for joining us.
Thank you for having me.
So just tell us, what does it mean to get this award this year?
It's
It means a huge amount actually, because it's nominated by my peers and colleagues, and to be recognised by people that I admire and respect is fantastic. It means that the work that I've done is more than something that I just am excited about. Others appreciate and value the work and contributions that I have made.
And so tell us, what led to it?
I think it's the accumulation of many years of work by not just myself, but members of my team and collaborators, where we've been really trying to use genetics as a tool to understand what goes on in the pancreatic beta cell and how that can lead to a variety of different forms of diabetes. So over the last 20 years or so, we've really been detectives trying to study DNA sequence and work out how this stops the insulin-producing beta cells from either becoming beta cells in the first place or from being able to make the hormone insulin.
Have you found that changes in the DNA sequence can alter diabetes risk?
Absolutely. There are many different ways that changes in your DNA can alter your diabetes risk. Sometimes it can be as simple as having a single change in your DNA sequence that leads to a rarer monogenic variety of diabetes. And these forms of diabetes are really important to identify, because if we understand what the underlying genetic cause is, it changes the way that your doctor treats your diabetes. But for the most part, people have type 1 or type 2 diabetes, and in those cases it's not quite so straightforward. There are hundreds of changes in your DNA sequence that contribute to your risk of developing diabetes. And over the last 20 years, we've started to sort of unpick those and to understand the puzzle of both type 1 and type 2 diabetes. And now we're seeing the fruits of our labor, because we're starting to be able to use that information to think about prediction for type 1 and type 2 diabetes, and also to put people into different subtypes of diabetes so that we can tailor treatment.
I'm a type 1 diabetic myself, and that was one of the things that my endocrinologist shared when I was first diagnosed. We don't know a lot about, why, but we have a great idea about how to treat it. So
yes,
we're trying to bridge that gap.
Absolutely, and I think, for a long time we thought that there was just one type of diabetes. Then we were able to understand that there was type 1 and type 2, and now we're realizing it's far more complex than that. There are many different ways to become somebody who has diabetes, and we need to understand those different routes, because different approaches and treatments are likely to be more effective in people who have a particular defect than in others.
So let's talk a little bit more about that, how we're translating that research into practical application.
Let's start again with the simple forms, those single gene defects. We already know that if you have a mutation, for example, in one of the genes that encodes for the potassium channel in the beta cell, that we can treat those patients with high-dose sulfonylurea tablets rather than giving them insulin injections. And that's a really important translational opportunity to take somebody off lifelong insulin and allow them to treat their diabetes with a simple tablet. But now for type 2 diabetes, for example, we're starting to see that we can use genetics to understand if there are groups of people who perhaps respond better to a GLP-1 receptor agonist rather than an SGLT2 inhibitor. And that means your primary care doctor can make decisions about the best treatment for you based on which one is most likely to be effective given your genetic background.
So tell me a little bit more about what the collaboration has done for you.
Well, for me, science is a team sport. It's about those connections you make at meetings like the ADA. I remember coming to the ADA back in Philadelphia in 2001, I think. It was my first ADA meeting. And the scientists that I was introduced to there have become colleagues and lifelong friends. And it's those continual conversations that you have with people who share your passion to solve the puzzle of diabetes that means that you start to put together long-term projects and collaborations that allow you to make real changes to your work.
That's so amazing, and just another great testament to what makes ADA and makes this particular meeting so important. Thank you so much for joining us. Congratulations again
Thank you
on
very
your
much.
award.
Thank you.
We're going to be back with more Clue Today on ADA TV. Thanks again, Anna. That was truly a fascinating interview. The rate of innovation in type 1 diabetes care has never been higher. Recent work by a team at Children's Mercy Hospital has demonstrated that it is feasible to predict negative clinical and operational outcomes. Yet it remains challenging for stakeholders, including persons with type 1 diabetes, providers, and payers to discern the real cost and benefits of any innovative intervention designed to improve these outcomes. Let's see how the Rising Tide Alliance is changing that.
Type 1 diabetes care has traditionally been delivered in what can best be described as a one-size-fits-all model, and a model that is heavily dependent on in-person clinic visits that come at great burden and expense to families dealing with type 1 diabetes. The Rising Tide Alliance is a multidisciplinary initiative funded by the Helmsley Charitable Trust and hosted at Children's Mercy Hospital that aims to create a precision approach to diabetes care that reaches beyond the walls of the clinic and that we can eventually disseminate to diabetes centers globally.
To my family, this initiative means that my 11-year-old son can grow up to be a happy, healthy young adult and lead a long, healthy life.
Diabetes-Free South Carolina is a bold, long-term commitment designed to reduce healthcare disparities in the Palmetto State by drastically reducing the incidence of diabetes and its complications. Let's take a closer look.
Diabetes-Free South Carolina is a new organization which is committed to serving everyone in South Carolina with a particular focus on underserved minorities who bear the brunt of the diabetes pandemic. So we aim to have a geographic statewide effect within South Carolina. Blue Cross Blue Shield and the Blue Cross Foundation came forward with a truly visionary idea and willingness to invest in the long term over years and decades. We have partner organizations that we work with to promote the program, and we have partner organizations that we're providing funding to. We've got 15 significant funded programs. We've been very excited recently by new funding of 5 women's health initiatives scattered all over the state, which are intended to supplement our pregnancy programs by improving pre-pregnancy counseling and postpartum care, but more generally to address women's health issues, because we all know that women are the key determinants of health in any community and any family. Early intervention sets the scene for the rest of life in doing something to turn around the diabetes pandemic in our state.
Hi, I'm Cassandra Henderson, and I am a member of the ADA Membership Advisory Board. I'd like to welcome you to the ADA Annual Scientific Sessions, and we are here to encourage you to visit the scientific investigators, the young scientific investigators who've been awarded for their research by the special interest groups of the ADA.
Hello, my name is Henry Rodriguez. I am chair of the American Diabetes Association Membership Advisory Group. This year, we have 12 professional interest group leadership teams that selected outstanding abstracts from early career members to receive awards and recognition. To be considered for these awards, abstracts must have been accepted for presentation at these 82nd scientific sessions and must be presented by a member who's within 10 years of their terminal degree.
The special interest groups have identified young investigators who have dynamic research in various fields that affect diabetes. That includes immunology, pregnancy and reproductive health, as well as technology and diabetes in youth. We would encourage you to visit their sessions and their poster presentations to discuss their exciting work. Thank you.
Thank you, and hope you enjoy your time here at the 82nd Scientific Sessions.
Welcome back. You know that diabetes is so impacted by nutrition, one of the most important things that we can do as far as management. And we have a team here that's going to tell us about some of the newer ways that we may be looking at nutrition in diabetes treatment. We're talking with Roberto Malta from the University of Pittsburgh, Gulshan Chen from the University of Tennessee at Knoxville, and Meg Moretta from USC. Welcome, guys. Tell us a little bit about some of the research that you all have been working on.
So we specify on diet intervention and how it affects type 2 diabetes. In my group, we actually look into the repercussions in the liver and how it affects hyperglycemia control in preclinical models and then in the clinic.
And so you have to take what you guys learn and research and bring it to people.
Yes, we come to these meetings and we learn what's going on, and then we transfer it to to our patients. So what I do is I work specifically with each person individually, and I meet them where they are, and then we start making changes. And we're moving towards personalized nutrition. So it's not a cookie cutter. It's not like, here's a diet sheet. It's not like that anymore. We're really trying to personalize it and bring in different, their favorite foods and their cultures and mixing it in and then learning how to modify it so they just have better outcomes.
Because as we were talking about earlier, there is no magic diet.
No, and that's the hardest thing to get across from people because they are looking for that magic bullet. And it's not like that. And everybody's very different. I mean, now that we have CGM sensors, we're really seeing how food impacts their blood sugars.
Can you tell me more about the ADA's Diabetes Food Hub?
They have a great food hub that you are able to access, and I share that with all my patients. There's recipes and there's tips, so it's a really great resource for people.
Now, you mentioned CGMs being an important tool. Tell us how that's really helping.
I think it helps because it allows patients the education they need on their control. And I think part of the efforts from the ADA is also being shown in the food hub, all of these different mechanisms that the patients can actually get resources to do. And part of it is the research that we're doing translates into what patients actually get out of the educational aspect of the ADA, the software that we're using, programs that we're using, and then making sure that patients get the education that they need to get better outcomes.
Yeah. They can also learn from their own observation and what are the food good for them, what are food that going to hurt their health. Mm-hmm. So we are still in the process to understand the whole thing, and everybody is different from the genetic setting and the culture of their food, what they like to eat, and the way they cook their food. Mm-hmm. All this contributes to the final outcome in terms of diabetes is blood glucose.
And so again, as we stressed, it's such an individual thing for each person. You guys were talking about some metabolism studies here, particular vitamins and nutrients. It gets down to real minutiae, right?
It really does. I mean, nutrition really is at the cellular level. So I mean, what they're doing is really like important work. And again, then that helps us translate it to people with that, and having our patients learn how to balance their meals, and because sometimes it doesn't come naturally to people.
So any new things that you are going to be looking into that you want to share?
I think the overall aspect is we're looking into wide studies about genomics, and I think that anticipates where our efforts have to be guided. I think those studies that take big populations, big data, and incorporates all of these knowledge from preclinical settings helps elaborate into new individual and personalized medicine. That's what we're trying to approach. And I think some of these studies are being done here at the ADA, and many of the people that are sharing the research and everything makes an impact on how the bench side is actually affecting bedside as well.
Yes.
So what can you say for patients that just may be struggling today? What's the number one thing you want to tell them?
I usually have them pick one thing to work on, because then it's not so overwhelming. And then they also will, once they start working on that one thing, they get a win. Like they see like, oh, I can do this. And so one thing can transfer to two things, can transfer to three things. So they keep working on this, and it's those little wins that really make a difference with people. Seeing their blood sugar better, or they're able to move better, or they're able to sleep better. So those are all everybody's different, so we work on different things with each person.
They should trust science. Mm-hmm. They should believe professionals. Mm-hmm. And trying to learn for themselves. That's another thing, because you just cannot listen and trying to say, that one works for somebody else, must work for me. Yeah. Maybe not. You really have to listen to your registered RDs, our doctors, and trust them and trust the science.
Yeah. And I think that's a great way to leave off. Yeah. Thank you all for joining us today. We're going to have much more for you coming up through the day on ADA TV. Well, that's it for us today. If you enjoyed this episode of ADA TV, keep tuning in. On TV screens around the convention center, in select hotels, on hotel shuttle buses, on the Scientific Sessions website, and on YouTube and Twitter. Be sure to check out the ADA TV newsletter by scanning the code on your screen. We'll be back again tomorrow with more research highlights from around the world, plus a look at the annual 5K at ADA, an interview with Banting Award winner Frances Ashcroft, and so much more. Until next time.